Alright, you guys, welcome back. Here we go. Just wanted to check in. Thank you for getting your injuries posted last week. Looking forward to seeing your presentations on those. If you haven't already, this week I'm having you guys post a video either using Screencast-O-Matic or Zoom. And you just need to do the introduction to your presentation. Super quick and easy. All I'm looking for is that you can get on, do it, and post it so that I can view it. So it could just be something like this. It could be like, hi, my name is Michael Cutler, and I'm doing chapter 21, the thigh, hip, groin, and pelvis. Okay, but obviously for your injury. So it just needs to be a couple seconds, just like that. 10-second video. Post that, and then I'll check that I can view all of them. That way we don't run into any issues when we get to actually presenting them and posting them. Okay. So we're on chapter 21. There's a lot of material on this one, so there's going to be a couple extra videos, and I'm going to get right to it. Okay, so the anatomy of the thigh. We'll start with some bony anatomy. Here is the femur. Okay, so the femur is your thigh bone. And there's only a couple things I really want you to know, but up here at the top, this is the femoral head. Okay, the femoral head is what connects your femur to your pelvis. And so that is really what the hip joint is this area. This is the hip joint. Okay, so that's the femoral head. And then out here on the outside edge, we have the greater trochanter. And if you were to feel on yourself, if you feel your side, you can feel the top of your hip bone. And then if you go down a couple inches on the outside of your hip, you can feel a bony prominence, and that is your greater trochanter. Okay, so it's at the top of your femur, outside of your hip, but it's a couple inches below that rounded hip bone that's up in your side. Okay. So we have our greater trochanter. That's a big attachment site for a lot of muscles that are in the posterior part of your hip, your glute muscles and piriformis and stuff like that. So that's an attachment site, femoral head. Okay, and then this long part is the femoral shaft. Okay, and then down here distally we get into the knee joint. So we'll talk about all this stuff when we do the knee. Okay, but that's mainly what I want you to know. Femoral head, greater trochanter, femoral shaft. On the back here is the linea aspera, and that is attachment sites for posterior muscles like hamstrings and stuff. But those three are the main I want you to know. Greater trochanter on the outside here, femoral head, and then the femoral shaft. Okay. Moving on into some muscles. Okay, this is the front of someone's hip and thigh. This is the posterior side of someone's hip and thigh. Okay, first I'm going to start with some hip flexors. Okay, so that's what brings your knee up towards your chest. Okay, and we have two main ones that I want to talk about. The iliopsoas, which a lot of times we shorten to psoas, is really consists of two muscles, but the main one that does hip flexion is your psoas major. Okay, if you follow that line in, you can see the psoas major goes across the hip like this, and it actually attaches back here. This is your low back, your lumbar spine. So it attaches onto your lumbar spine and then comes through. Obviously you can't see it, but this is the person's abdomen. All right, so it kind of comes across their abdomen into the front of their hip, and then comes down the thigh and attaches in down near the knee on the front of the thigh. Okay, so that helps pull, if you think about that muscle contracting, that helps pull the knee up towards the chest. Okay, I like to point this out because different athletes that have a lot of knee flexion from jumping or even hip extension, right, when you jump and you have to extend your hips all the way, it can pull and create a lot of tug in this muscle. And a lot of times people in those kind of sports, running like track or jumping like volleyball or basketball, they end up with a lot of low back pain in this area. And a lot of times it can be attributed to the psoas major pulling and tugging on those lumbar vertebrae. And so really what we need to do is stretch and open up the front of the hip in order to alleviate that low back pain in the back. Okay, so that's the psoas major, does hip flexion. The other one that does hip flexion is your rectus femoris, way down here. Okay, it's one of the quadricep muscles, and you can see it right here. It comes all the way down and crosses the knee, which we'll talk about next week. It does knee extension, but it also comes all the way up and crosses the hip joint and does hip flexion. Okay, so the rectus femoris and the psoas major are those two main hip flexors. Okay, and then on the outside of the hip, we have the tensor fascia lata, and that is this little muscle right here. It does abduction of the thigh, so it allows the thigh to come out like this, and abduct, okay, abduct away from the midline. And it also does a little bit of external rotation, so rotating your knee and your hip outward. And it comes down and it connects into the IT band, iliotibial band. Okay, and that iliotibial band comes all the way down the outside of your thigh and doesn't actually attach until below your knee. Okay, and the iliotibial band is just fascia. It's just connective tissue that connects this muscle that's way up here all the way down to the bony insertion spot down here. Okay, and then if you're looking from the back side, you have different glute muscles in here, the main one being your glute max. But those are also going to feed into that IT band that comes all the way down past that knee. Okay. When looking at the medial compartment, so the inner thigh, the inside of the thigh, we usually call that your groin. But what it really is, the groin is really just a combination of adductor muscles. So adductors, okay? Adductors bring the thigh towards the midline. Okay, so now say you have your thigh out here, the adductors pull it back in towards the midline and even across the midline. Okay, so we have all these adductors. I don't need you to know all of them specifically. Titanius, adductor magnus, adductor brevis, adductor longus. Those are all part of the groin and the adductors. I do want to point out the gracilis, okay, because the gracilis is on the very inside here, and it comes, get rid of that real quick. It comes all the way down past the knee joint and attaches in down below the knee joint. Okay, so and I'll talk about that insertion spot more when we do the knee, but the gracilis is important because of that. Okay, but all of these are just adductors of the groin. Okay, then in the anterior compartment, on the front of the thigh, okay, we have 4 quadricep muscles. Quad meaning 4 of them working together that do knee extension. Okay, and they all start up here in your thigh. Okay, we talked about the rectus femoris, which does hip flexion and knee extension, but that's right here in the middle. Okay, and then on either side of it, we have the vastus medialis and the vastus lateralis. Okay, and then, so that's these 3. And then if you see vastus intermedius, we actually don't have a line for it because it is underneath these 3 muscles. It sits below them, so you can't really see it, but it's the 4th quadricep muscle. Okay. And then looking at the posterior side, okay, so we did the front, we did the side, we did the inside. Now we want to look at the back of the thigh. Okay, we got glute muscles up here. We actually have a glute minimus that you can't see in this one. And we have the glute med right here. Then we have the glute max. Okay, and that feeds into that IT band. Okay, but then the main thing I want you to know is right below that we have the hamstring muscle group. Okay, and the hamstring muscle group is made up of 3 muscles. Okay, the first one is the biceps femoris, which has 2 attachment sites, long head, short head. Okay, but the biceps femoris is right here on the outside. Okay, then in the middle here we have the semitendinosus. Okay, and then even more on the inside here we have the semimembranosus. Okay, and the way that I remember where those ones are is that the semimembranosus is more medial. Okay, membranosus medial. Okay, and so that is this inside, more medial muscle. Then we have the tendinosus, and then the biceps femoris is on the outside. Okay, and those are all helping with knee flexion that we'll talk about more next week. But they also do hip extension. So they come up and they cross the hip joint up here underneath the glute muscle, and they do hip extension. So if you're thinking about running to propel yourself forward, you need a combination of hip extension, swinging that leg back, and also knee flexion, flexing that knee as you propel yourself forward. So if the hamstring does both of those, hip extension and knee flexion, that's just one of the reasons why it's very, very important when it comes to running. Whether that be track athletes or cross country or soccer. I mean, obviously a lot of other sports as well, but super important in those ones. Okay. Moving on here, the quadricep, again, we'll talk about it more with the knee, but it attaches into the patellar tendon down at the knee joint. The rectus femoris is the only quad muscle that crosses the hip and the knee. So it does knee extension and hip flexion. Okay, and so that's one of the reasons why it's really important with a hip flexion injury to distinguish whether we're talking about the rectus femoris or the psoas muscles. Okay, really important for the treatment and rehab of that. The hamstrings cross the knee joint and the hip joint. We talked about that. Okay. And then we also need to get into some of the anatomy of the pelvis. We just talked more about the hip and, the thigh and groin. But I'll stop it right there, and then we'll have a separate video to talk about the anatomy of the pelvis. Okay, so mull over that. If you have any questions, let me know. Post it to that discussion board, and then I'll come back with another video about the pelvis. Okay.